Hello everyone, I'm Dr. Lori Langdon, board certified pediatrician, mother to 6 and grandmother to 2, here today with a video about when well child checks should happen and why they are so important. So this should be relatively quick and easy. Your very first well baby visit will be for your hospital follow-up after discharge from the hospital, and the American Academy of Pediatrics recommends that that very first visit be within 24 to 48 hours of hospital discharge. Then based on that visit, if we need to do additional weight checks, we'll let you know. The next routinely scheduled well visit is typically at 2 weeks, because by that visit we hope that the baby's cord is off and the baby is back to birth weight, and we'll talk about additional things as well. At that visit, we will start screening the moms for postpartum depression. I do have another video with more details about postpartum depression, and we continue to screen for that at each well visit up through 6 months. And then after the 2-week well visit, we do a 1 month, and then a 2, 4, and 6 month. The baby will receive the primary series of vaccines at the 2, 4, and 6 month visits. We also begin a developmental screening called the Ages and Stages Questionnaire at that 2-month visit. That will extend all the way through the 5-year well check. So we had newborn 2 week, 1 month, 2 month, 4 month, 6 month, and then we start stretching out a little bit. We go 3 whole months until the 9 month, then 3 months till the 12 month, 3 months till the 15 month, 3 months till the 18 month well check. Then we start stretching out even more till the 2-year well, 2.5-year well, 3-year well, and after the 3-year well, we do recommend having a yearly well visit. So what other assessments would we do? At the 18-month well check, we would not only look at the Ages and Stages Questionnaire, but also the modified checklist for autism in toddlers. And that's done at both the 18-month and the 2-year well. Depending on the baby and its tooth eruption, we may apply dental varnish to the teeth to help prevent cavities. At the 12-month well and the 2-year well, we will check a complete blood count and a lead level. So there's just all sorts of things we're doing. We're monitoring the baby's weight, length, and head circumference until 2, and then beginning at 3, we start monitoring the child's blood pressure. There are so many developmental milestones a baby needs to meet in order for us not to become concerned. The reason this is important, and if there is a concern, pediatricians believe so strongly in early intervention. If there is anything at all wrong with development, the sooner we can figure it out, the better our chances are at getting the baby correct therapy to help it so that it can have more typical development later on. So it's really critical to monitor the baby's growth and the baby's development, and for the babies to receive their routine childhood immunizations. The baby's vaccine schedule was not developed arbitrarily. Everything is offered at specifically the right time in order to most protect the baby from the various diseases that could damage it along the way. So much study, time, trials, prep, reanalysis has gone into our current routine childhood vaccine schedule. You know, during the pandemic, we have seen a decrease in the number of routine childhood checkups and childhood vaccines, and both of those things are concerning. We certainly don't want to have a return of measles or pertussis or things that we should have already been able to get rid of if everyone were vaccinated. So not only is it important to keep track of your children's well visits for the vaccines, but also so that we can appropriately monitor their development. Now, years ago, once the baby passed about 5 with kindergarten vaccines and that official kindergarten checkup, we often wouldn't see kids but every 2 years, 3 years, but the American Academy of Peds definitely believes we should do a routine yearly well check every single year, because other things can come up: hearing loss, vision changes, school concerns, difficulties with concentration, mental health issues, which you know are just surging right now in the U.S. to the point that the American Academy of Pediatrics has declared it a crisis right now. It's a real problem, particularly in teenagers, but we've seen anxiety even in younger school-age children. So we do start to screen the teens for depression with a test, a very validated screening tool called the PHQ-9, or Patient's Health Questionnaire, and it has 9 questions on there to help us determine how severe a child's depression could be at the time of that well check. So I hope this has reminded you guys that it is extremely important to keep your children's routine checkups as directed by your pediatrician, and at every well visit we'll let you know when we next need to see them. And if you look on the website of most pediatric offices, they can let you know too when the routine vaccines are due and when the routine checks are recommended. So I hope that was helpful. Thanks.